everyone, welcome to the next installation of our 6-part series. We're going to be talking about viruses today. I'm Jess Hickman, practitioner assistant, and I'm here with Dr. Nicole Rivera.
Hi everyone.
So Dr. Nicole, what differentiates viruses from other pathogens?
Well, viruses, one of the biggest things for people to know is that viruses will always remain in the body. So they are something that will actually affect your DNA. So when you do come in contact with a virus, no matter what, when you do testing moving forward in the future, you will see it showing up. Typically, it will be showing up as a past infection. But with viruses, they can definitely reactivate at times when the immune system is down. And sometimes the immune system is down because you just got a common cold. It could be down because of stress or just being overworked, kind of burning the candle at both ends, which a lot of us do here in the tri-state area. And it also can come on when maybe there is something environmentally that's happening. A lot of times when people move into a new house, apartment, etc., and sometimes there's a mold issue that's going on that obviously they don't know going into it, that can really jar the immune system, which will cause different viruses to come back to the surface. So it does manifest quite differently in the system, and it does have the capabilities of kind of storing itself in very specific tissues of the body. So sometimes even if, say, it was affecting tissue of the neck, you got hit by a car, maybe you were rear-ended and you had whiplash, you might actually exhibit some flu-like symptoms because your virus is being released.
So how are you seeing viruses affecting the health of patients here at IWG?
Well, I think one of the biggest things that we see is most people that we're working with have some level of a low functioning immune system. And it's kind of hard to say chicken or the egg. Is it that they have come in contact with so many infections in their life that has lowered the immune system? Or has the immune system been low that has allowed them to acquire these infections? You definitely can see it swing both ways. But again, like I said before, sometimes environmentally, if you work with a lot of chemicals, maybe you're a mechanic, maybe you work developing film, or maybe you ended up working or living in a moldy environment, those are things that can also impact the immune system, which will then allow you to acquire more and more infections. So there's definitely quite a bit of viral burden that I do see with a lot of our patients. Usually they're not just showing up with viruses on their own. A lot of these viruses are living side by side with parasites and bacterial infections as well. And it's not always that the virus is active. So much of the time we're looking at the blood and we're looking at these viruses and they're showing up as past infections. But what's interesting is that if you have a virus that is actually affecting, say, the brain or the nervous system, so it could be the spinal cord as well, it's not going to show up as an active infection in the blood. And that's something that's really important for people to understand is some of the testing that we do here, we're looking at the body in a different way. So when we're actually evaluating, we're evaluating for infections, but we're evaluating what is where. And, I think I might have told this story on a previous one of our episodes, but one of our patients, he actually showed up with a past infection of Epstein-Barr virus, the virus typically associated with mono. He showed up as a past infection in his blood. And we went forward and we did our autonomic response testing. And when we were doing that, he responded to a therapy that we do called Viaderm. And the Viaderm is actually linked to treating very specific meridians. And the meridian that came up was the meridian that is associated with the brain and spinal cord. And that meridian was specifically needed therapy for Epstein-Barr virus. So it was actually a homeopathic version of Epstein-Barr was the treatment that he was coming up for. So pretty much what that's telling us is that the Epstein-Barr was not in his blood, it was actually living within the brain and spinal cord. And to kind of take that a step further, this is a patient who multiple sclerosis runs in his family. And multiple sclerosis is one of the primary triggers for it is Epstein-Barr virus that ends up in the central nervous system, aka the brain and spinal cord.
Wow. Can you talk more about the different diagnostics that we use beyond ART to kind of pinpoint viruses?
Yeah, so blood, of course, is one of the ways that we go when we're looking for viruses. But telling that story, it can be ambiguous because it can appear to be a past infection, but at the end of the day, it could be causing more problems than we realize. And I feel like one of the books that actually goes really in depth about Epstein-Barr virus is actually The Medical Medium, if anybody has read that. Don't get me wrong, I feel like that book is very, very focused on Epstein-Barr being the primary trigger for most chronic illness. And just based off of, doing clinical practice, it is more expansive than that. But there is a lot of in-depth about Epstein-Barr as well as the symptoms associated. But in addition, we also use our bioscan unit. So that is actually one of the modalities that Jess is working with right now. But the bioscan is really, really interesting because what it's able to do is actually scan the body for different stressors, and it actually can decipher if something is acute versus chronic, which is really valuable. Because if you're seeing something acute, that's when we start thinking, oh, okay, well, this virus is active right now. It's playing a role in this person's body. And then if we see chronic, then we know that this virus, this person has come in contact with this virus in the past, a long time ago. So it's been in the system for a long period of time. So that is another modality that we bring or bring to the surface in order to really understand the dynamics of these viruses, to know, are they active, are they not? And then also the ART allows us to know, where are they in the body?
That's great. Can you talk a little bit about kind of the relationship between vaccines and viruses and the correlation?
Yeah, so most of our vaccines are to protect us and create immunity to different viruses. I think the one thing that is not always well communicated is that vaccines are not always going to create immunity. And what I mean by that is, just because you administer a substance into the body, it's expected that it's going to create an antibody, which the antibody is then going to create immunity. It doesn't always work that way. Just because you have an antibody does not mean you have immunity. And I think that's very important for people to understand, because if you do have a vaccine and you get symptomatic afterwards, you get maybe flu-like or you get sick, chances are you were infected. You did not create immunity at that time. So it's just important to know that when going into getting vaccines, you really actually want to make sure that your immune system is working optimally. If you are someone that you find you are getting sick a lot of times you're going to be recommended to get vaccines to give you added protection. But unfortunately, if your immune system is non-functional, it is not going to have the capabilities to create that antibody and create that immunity. So it's just very important to take that into consideration, to know that just because you get a vaccine does not equate to immunity at all times.
So how else can we protect ourselves from viruses?
Well, with viruses, you can't live in fear. They're everywhere. That's one thing. But, and I know this might sound super counterintuitive, but honestly, using less antimicrobial soaps and hand washes and face washes and harsh cleaning products in our homes helps. And the reason why I say this is because the more that we're trying to kill the bugs, kill the bugs, kill the bugs, kill the viruses, kill the viruses, kill the viruses, we create a level of resistance with these bugs. These bugs are smart. And I say bugs, and I mean bacteria, and I mean viruses, I mean all of it. They actually have the capabilities to become resistant to what we're using to kill them. So honestly, less is more. So it's definitely really a matter of taking a step back with all of those, sanitizing and purifying.
We're also killing the good stuff.
Yes, and we're killing the good stuff. And I'm glad that you said that, because this really goes to some of the food as well. So it's not about topical always, it's also about internal. I don't think people realize we're actually 80% of our bodies is bacteria. So for us to be overdoing antibiotics and also eating food that contains antibiotics, which is your traditional conventional proteins, chicken, beef, etc. I know that there's a lot of people hearing about organic versus not, and they're like, who cares? Doesn't matter. I don't know the difference. And really, at the end of the day, the biggest thing you need to know is that most of your conventional animal protein, it contains antibiotics, because these animals are sick because of the close quarters that they live in, and they're not roaming and grazing. They're not eating healthy food. And because of that reason, they're getting administered antibiotics in order to help keep the bacterial load down so that they can cell, which is kind of disturbing when you really think about that. On top of that, you know, if you're eating foods that are administering antibiotics, you're going to deplete your good flora. But then there's this whole realm of GMOs. And GMOs, the primary thing we need to know about is glyphosate, which is technically in Roundup, which we kill our weeds with. So glyphosate is known to not only wipe out all of the good bacteria of your gut, but it also is known to induce leaky gut. So I have patients that come to me and they say, can you test me for leaky gut? And I'm like, no, you have it. Do you eat 100% organic, grass-fed, pasture-raised, wild, etc.? Do you eat that 100% of the time? Nobody does. It's not real life, unfortunately. And I'm like, well, yeah, you have leaky gut because the GMOs induce it 100%. So that's definitely something that plays a role in our immune health also, which is making us more susceptible to these viruses. So I don't want that to sound super depressing. So really at the end of the day, there's very simple analysis that you could do with us, with your primary care physician, to really figure out where your immune system is at. You could do this through blood work and really know if you need to do some things in order to get your immune system functioning more optimally. If you're someone who gets routine blood work and the WBC, the white blood cells, are always low, you have a low functioning immune system. You really need to, first of all, figure out why, and then second of all, learn the tools of how to bring those levels up so that you can protect yourself.
Definitely valuable information coming into the winter season. So thank you, Dr. Nicole. It was very helpful, and we look forward to seeing you guys next time. We're going to be discussing methylation in the next episode of the series, and bye for now.
Bye.
Tell me that it closes off. It just like stops.
Oh.
Did you get the end of her
got
talking?
The
Okay. What about thank you, Dr. Nicole? Like thanking her? Did you get that? Oh, I'll just say it.
The whole closing.
All right. Well, thank you, Dr. Nicole. That's very helpful, especially coming into these cold months when we definitely need to boost our immune system and take care of ourselves. Thank you for joining us, and we will see you next time for our episode on methylation. It's the next part in our 6-part series. Until then, bye now.
Cool. At the end of these, you probably want to insert like the call to action too of
The next one.
strategy call and whatever else.
Mm-hmm.
Yeah, we can do that.
Yeah. So that will definitely be good.
That's good. I like when you talk about like the bioscan and whatnot, because I feel like people just don't, like when I mention that, people are like, what do you do? And I'm like, oh, I do a lot of bioscan. They're like, I have no idea. No one knows.
Yeah.
So it's good for people to kind of have it in context.
Yeah, understand it.
Do you want to do the next one? What time is it? All right. Give your call.
Oh, I'm gonna stop this.
Oh.
1:10. How long was that one? Like 13 minutes? That was
Yeah,
short.
that was a short one.
Oh my god, my stomach.
Want to do it later?